All right. So, welcome. My name is Dr. Isang, and I'm a cardiologist, and I practice general cardiology medicine. So, when it comes to cardiology, when it comes to your heart health prevention, why is it important is going to be the biggest thing. And the reason that it's important is because prevention is a lot better. It's a lot um, better for our economy, better for everything if we can prevent heart disease from happening. So, how can we prevent heart disease? Is understanding what the risk factors are for heart disease. Things like hypertension, high cholesterol, um, or hyperlipidemia, diabetes mellitus, a strong family history, smoking, genetics. So, making sure that you follow up with your family to see if they have heart disease or they have somebody in their family who has had heart disease. Because if they do, you may need to get tested for it. What's the biggest example? Something called familial hyperlipidemia or a family history that leads to high cholesterol. High cholesterol can lead to plaque buildup, plaque deposit into the arteries, which can cause a heart attack in the future. How bad have I seen it? I've seen a patient who had a heart attack in his early 20s. I think he was 21 or 22. His mother, 30, 40 years prior had a heart attack in her 20s, around 25, 26. So unfortunately he wasn't being treated for high cholesterol and eventually had a heart attack. So it's always important to talk to your parents, talk to your family members to make sure that you are not at risk of having heart disease in the future. So you know there are some things that we cannot control, such as our genetics. We can't control being born with familial hyperlipidemia. We can't be born with having a higher ability to develop high blood pressure. What we can do is understand that other than genetics, there are other things that we can do to prevent heart disease from happening to us. First, it starts with talking, but understanding that if we can control our nutrition, if we can take better control of our exercising consistency, we recommend 150 minutes of moderate intensity activity, but I reference more on being consistent. For instance, I'm going to probably work out for 15 to 20 minutes today. That's all that I can allocate. Ideally, we're saying 30 to 50 minutes 3 times a day, 3 times a week, 3 to 5 times a week. I can allocate at this time of my life in this week 15 to 20 minutes, but I can be consistent with it. I can do this every single day and see the same changes as someone who is, hitting the gym an hour, but 2 to 3 times a week. So just making sure that you're consistent with your exercise regimen, but also sticking to a nutrition that is supplements this. So what does that mean? You cannot go and work out for 15 to 20 minutes or 2 to 3 hours, but then go and eat trash and expect that you're going to see the outcomes. You cannot outwork a poor diet unless you have great genetics. But not everyone is born with those great genetics. Unfortunately, we see a lot of people on social media, and guess what? They have amazing genetics. So we think that we can achieve the same things that they can, but in reality, we sometimes cannot. I have personal friends who eat anything and everything that they want and they don't gain any weight. They look amazing. They work out a few times and just look amazing. That is not for everybody. Some people are going to have to hit it, grind, and be consistent with their nutrition, be consistent with their exercising to see the change. And what I typically say is that if you can do it for 1 month, you will start to see those changes anywhere from 2 to 4 weeks. But then, the 6 to 8 weeks, people close to you will see changes. And then 8 to 12 weeks, everybody else will start to see those changes. If they're subtle, if they're drastic, of course, you can see that a lot sooner. But I say 3 months, that example for 3 months, because that's sometimes what it takes, being consistent for 90 full days. And I think that's in anything in life, that if you can be consistent that well for that long period of time, if you can show that you are, willing to sacrifice not eating bad things, eating a balanced nutrition, waking up early, drinking enough water, getting enough nutrition, that you'll start to see those benefits. But that's in anything in life, whether it's your nutrition or your health, whether it's your knowledge in wanting to learn another language or wanting to do whatever your mind can fathom. It starts with consistency. And with prevention, also with consistency, I mentioned following up with your primary care for you and your family with genetics, but you also want to make sure that you don't have any underlying issues that can lead to heart disease. Some people can have heart disease due to issues with your thyroid, either hyperthyroid or hypothyroid that has been untreated. Sometimes it can be due to issues with the hormones. A lot of people who are perimenopausal or going around menopause will start to develop some changes in their bodies, which can lead to heart disease if not caught earlier, but can also lead to things like osteopenia, osteoporosis. Understanding that other hormones in our bodies are very essential, and if we're not getting enough of it or if we're getting too much of it and if we're not following up to make sure that our levels are stable, we can it can lead to heart disease. Estrogen, testosterone are one of the biggest examples. Too much, too little can lead to significant changes in our bodies. But this all starts with just following up with your primary care, following up with your family to make sure that you're not at risk. You don't carry a gene that can potentially impact you not now, but in the future. And that leads to another topic of heart disease not showing itself now. Just like high blood pressure, some people can be living with heart disease right now, and they can go on weeks, months, multiple decades without showing any signs of heart disease until they go into the hospital and have a heart attack. So it's always important to follow up with your primary care at least once a year to look at those risk factors to make sure that you're not at risk. Look at your cholesterol, your blood sugar, your blood glucose, your blood pressure itself, and understanding that if we can control that a lot better, that we can potentially prevent heart disease from happening. So I'm going to leave about 30 seconds to a minute to be able to answer any questions regarding heart health and prevention, and then kind of give a little bit of a summary. So, any questions at all? All right, no questions yet, but so I'll talk about high blood pressure. What is high blood pressure? High blood pressure or hypertension, systolic blood pressure, the top number, that's the pressure around your heart, sorry, around your arteries when the heart is squeezing, when it's contracting. The bottom number, diastolic, is the pressure around the arteries when it's relaxing. You want it to be ideally 120 over 30. Any higher, the increased risk of having things like strokes, heart attacks, heart failure, dementia, etc. So we want to try to bring it down as low as we can to 120. But we also want to understand that we can potentially treat this without medications, understanding that you can treat it naturally with things like losing weight, exercising consistently, watching what you were eating, getting enough sleep, watching the amount of stress that you're under also too. All those things factor into your blood pressure, but also understanding that with your genetics you could potentially be holding on to fluid a lot more easier than under other individuals, holding on to salt a lot more easier. So if you've lost the appropriate amount of weight, if you're eating the appropriate amount of foods but you're still finding that you're having high blood pressure, then for those cases you may even want to consider being put on therapy for it, medications for blood pressure. um, but that's if it's consistently above 130, 140, and you've done everything to potentially bring it back down. um, I'm gonna try to change it up a little bit. uh, and you've done everything to treat your blood pressure and you're still finding that it is still elevated, then we will likely put people on blood pressure medications. So, what are the medications that we put people on for blood pressure if we have to? So, we have things like calcium channel blockers, things like amlodipine. Works well. One of the biggest risk factors, one of the biggest side effects we have to watch out for is something called edema or ankle swelling. We have thiazides, hydrochlorothiazide, chlorthalidone can cause potassium levels to be low because it is a weak diuretic, meaning that you pee a lot. We have things like ACE inhibitors, like Synapro works well, but can lead to issues with your potassium. For some people, can cause issues with tongue swelling, and we have and a cough. We have things like spironolactone works well, but for some men can lead to gynecomastia or man boobs. So we have things like nitrates, isosorbide work well, but sometimes can cause headaches. So you want to treat the patient with the right medication for them. So if someone already has ankle swelling, you may want to not reach for the amlodipine because it can make that worse. If someone already has issues with potassium, you may want to not reach for the ACE inhibitor initially, or if you do, you want to check your labs as soon as possible, ideally within 1 week. If someone already has headaches, you don't want to reach for the medication that could potentially cause headaches. Doesn't really make any sense. So, um, we find that if someone is on multiple medications, I'm talking about 3 to 4 different medications, including a diuretic, something like hydrochlorothiazide or like Lasix, then they may have secondary hypertension. What is secondary hypertension? This is high blood pressure that is due to something else, and that something else can be something like pheochromocytoma, which is rare, um, uh, fibromuscular dysplasia, renal artery stenosis, sleep apnea being one of the biggest causes of secondary hypertension. So, if we find people are on multiple medications for their blood pressure and they're still under control, then we have to start to work them up for that. And I hope you guys find benefit in this. My name is Dr. Isang, here to answer questions around the heart, surrounding prevention. I'm gonna give it another 30 seconds to 1 minute to try to answer at least any questions anybody may have regarding the heart health and prevention. All right, that does it for this time. I hope you guys were able to get some of your questions answered regarding the heart health and prevention.